and welcome to the Fitnatics. Today we're joined by Dr. Carole White from UT Health San Antonio. Hi, Dr. White. How are you today?
Oh, I'm great. So nice to see you, Susie.
Great to see you. So, Dr. White, let's get started. If you don't mind telling us a little bit about your background and area of expertise.
Okay, so I'm a nurse, been nursing for a long time. Always worked with patients with neurological conditions like stroke, Parkinson's disease, dementia, and so got very involved with working with their families as well. Saw the impact that these conditions had on their families, and so began to work with the family caregivers, which led to working more specifically with caregivers of stroke survivors, and then more recently at the university, I've started a program for family caregivers of people living with dementia.
Excellent. Very good. Now, on that particular topic, I do have some questions from fellow Fitnatics that I'd like to share with you today. So, we'll get started with that. First question is, what are some of the early signs or symptoms of neurological disorders that we should be on the lookout for?
So maybe I'll talk specifically about dementia first of all, and we know that the greatest risk factor for developing Alzheimer's or other forms of dementia is age, but we also know that it's not a normal part of aging. But people as they age, they do worry: is that like a normal symptom, or is that something that I should worry about? And so a lot of the things that we see as we age, like sometimes forgetting names, sometimes making a mistake with your checkbook, or sometimes just not wanting to be around people as much or withdrawing a bit. Those can be normal signs of aging. But I think what differentiates what might be something that indicates some kind of cognitive impairment is the magnitude and the frequency. So sometimes you might forget. You walk into the kitchen, you think, "Why did I walk there?" And then you come back, but you remember. But not even knowing where your kitchen is would be something that now the magnitude is much greater. Or not remembering the names of your kids. You might, sometimes just call one the other, but when you really don't remember their names or their date of birth. So things like that. And then the other thing is, this a change from what you've seen previously in terms of it's different, and the rate of progression is different as well. So those are all things that should take someone to see their doctor to see that this doesn't seem to be just a normal part of aging. And just when people talk about dementia, just to remember that dementia is really the umbrella term that describes some problems with language, speech, with comprehension, with memory, with perception, that really impairs your ability to carry out your daily activities. And then there's many causes of dementia. Often people refer to dementia and Alzheimer's disease synonymously or interchangeably, but it's because Alzheimer's accounts for at least 60 to 70% of types of irreversible dementia.
I see. Now, to take that question a little bit further, one of the questions was, how do you convey to your general practitioner the need for a little bit more testing in those particular cases, other than the typical 20 or so question tests that are administered?
So again, because some people just see these changes as a normal part of aging, some physicians may not, it may be reluctant to refer you for further testing. So I think it's important that the family is an advocate for their family member who might be experiencing these changes. And even though we don't have a cure for Alzheimer's or even good disease modifying therapies, we know there's benefits of an early diagnosis. And had many caregivers say to me, I just didn't know what was going on with my husband or with my wife. So getting that diagnosis, I knew what I was dealing with then. So that's, early diagnosis is important for that. Also, so that you set up a relationship with a care team. And there's a lot of trials now and we'll talk about that in a few minutes when we talk about fitness, but there's a lot of trials that are really focused on people with early stage. So it gives you an opportunity maybe to be part of a trial, contribute to research, and maybe even something that could be beneficial to you as an individual as well as future people.
Excellent. Very good. Now, when it comes to nutrition, are there any nutritional changes or supplements that we should be considering to prevent or slow down the progression of some of these diseases?
There may be kind of things you see in the popular media and things that come out, but we do know that what's good for the heart is good for the brain. So we talked earlier a little bit about stroke as well. So things that will be good for preventing stroke are also good for preventing cognitive decline. So people have talked in terms of diet about the Mediterranean diet, the DASH diet,
Mhm.
and then there's also something called the MIND diet, which is kind of a combination, but they really are kind of what we knew from our food guidelines years ago, but really, eating lots of fruits and vegetables, healthy proteins, cutting back on salt, particularly in the DASH diet, also grains, and really eating more fish, olive oil, nuts. We know nuts are an important part of the mind diet.
Yes, yes, very true. Now, on that note, can let's take it into the fitness and exercise, my favorite part.
Yeah.
Can you tell us what some of the research and studies have said with regards to exercise and what types of exercise are best for these particular conditions?
So there's a really interesting study that was in Finland, that took place in Finland, called the Fingers study, and I
Mhm.
can't remember all the things, the acronym that it stands for, but and I think it's because there's five components to it. But it has now gone to the worldwide Fingers and also to the Pointer trial in the U.S., and that's been a really important study where they've looked at a combination of exercise and cardiovascular is really what they've looked at mostly. So they've looked at cardiovascular, exercise, diet, and then controlling blood pressure and sugar, and then also cognitive stimulation. And they found this study was done on people that didn't have cognitive decline, so a prevention study. But they found that people, even that had one of the genes for Alzheimer's, still had longer time to cognitive problems, with that combination of interventions, that importantly exercise and diet, among other things. And then they're testing that now. So when you think of Finland, it's a very homogeneous population, unlike the US. So they're testing it across the US to see, among Hispanics, among African Americans,
Mhm.
among non-Hispanic Caucasians, does it make a difference as well? So we know
Mhm.
how important exercise is. There's also been there was a study that was published a couple of years ago that looked at, it's all epidemiological data, which means it's observational and not cause effect, but it
Okay.
knows that these things are risk factors. So it looked at a life course view of how to prevent cognitive decline and dementia in later life. And so it's found out that early childhood education was important. In midlife, controlling diabetes, blood pressure, um, diet, exercise, and on to late life, social isolation was negative. So social interactions, depression was negative. So across the life course, they looked at these things that were important for preventing dementia. And we know that lifestyle is an important part of it, exercise and diet.
Yeah, definitely, definitely. Was there any data that supported the or elaborate a little bit more on, of course, the cardiovascular, but how often? And I get asked that a lot. How often should we exercise? For how long should we exercise when we do, in terms of frequency?
So I know more from the American Heart and Stroke. They have something called Life Simple 7, which they've had this goal, because when they've tested the general population, it's a very low percentage of people, even among the general population, who would be called ideal health. And Life Simple 7 has, again, is very similar to what I was talking about, that lifestyle, fingers intervention, has built into it diet, exercise, blood pressure control, diabetes control, cholesterol control, not smoking, and obesity and weight. And so in exercise, in that, they talk about 240 minutes a week of moderate intensity exercise, which I don't know, that's still what's moderate intensity to me might be like almost no exercise to you, but but I think stuff that gets your heart rate up and gets you sweating. So
Yeah.
they talk about 240 minutes a week of moderate intensity would be put you in that level of for that single indice of ideal health.
Got it. Very good. Thank you. Now, what are your thoughts on brain games, things that have the cognition? Do you have any ones that you would suggest or recommend? Do you feel that they're helpful?
So there's a lot of kind of commercial things available, and there's not good evidence on them, although there is, as part of that fingers trial and that multi-component intervention, cognitive stimulation was important. So it's if you're really good at crossword puzzles, what I read is doing more crossword puzzles isn't going to help. You need to do something that challenges your brain. It not only does it need to challenge your brain, it needs to be something that's interesting to you that you'll keep doing, just like exercise. So
Right.
maybe learning a new language. There's actually some interesting um there's actually some interesting research being done on learning to play an instrument, and can it, either with people with early changes or without cognitive changes, can it delay cognition or
Mm.
cognitive decline? And they're seeing some of that. So it's doing something that causes you to learn in a new way. Actually, I heard somebody from the Alzheimer's Association said very simply, if you're right-handed and eat with your right hand, start eating with your left hand. It's making your brain think differently.
Yeah.
So
Awesome. Very
learning a
good.
new language, learning a new but also staying socially engaged. And that's a part of the cognitive interaction, is connectedness with people. And we know how important social engagement is. Now we know there's so much information that talks about what lack of social interaction or loneliness does to your health, including can kill you. So
Wow.
it's pretty
Okay.
serious.
Definitely. Now, Dr. White, what are some of the biggest challenges you see with family caregivers?
So we know that family caregivers take on the care of their family member out of love, out of sometimes because they're the oldest child, they're the
Hmm.
ones who will care. But we know there's consequences for caregivers to their physical health, their emotional health, and also social health, social interaction, and then particularly financial health is an important negative for families. So we but we know that there's benefits of education, understanding the course of the disease, the progression of the dementia or of stroke or whatever it is that you're caring for in terms of your family member, being well informed about the condition and what's going to happen in the future. And then really helping caregivers to have confidence in their caregiving role. Often caregivers are afraid, am I going to hurt my family member? Am I feeding them the right things? Should I be pushing them to exercise? What should I be doing? So understanding that role better and feeling confident, we know, is associated with better health outcomes for family caregivers. And so education, understanding the disease, and then finding support. Support groups aren't for everyone, but for a large number of caregivers, and particularly ones I'm very connected with right now, support groups have been so important to them. Caregivers say to me, "Nobody knows what I'm going through like another caregiver. I just have
Yeah.
to start talking, and I don't have to go through the whole thing." They say, "Yeah, I know what you're talking about."
Well said. Well said, Dr. White. Now, I have another question from a fellow fanatic, and she shared that her husband had a hemorrhagic stroke about in 2018. In 2018, and made great progress the following months after for about 3 or 4 months when he did his therapy. Since then, he's been complaining of some burning and just weakness overall on the left hand side, mainly in the hand and some in the leg. What are your thoughts? Because she feels as though if he continues to work on that side in terms of coordination and strength, that there would be some improvements. Do you feel that since the stroke took place, 2018, that at this point in time, progress can or cannot be made?
So when I first graduated, which I was a long time ago, and I've always worked pretty much with people with stroke my whole career, we kind of were told what you see at 3 months is what you get. Then we were told what you see at 6 months is what you get. But now we know a lot more about brain plasticity, and we know, the improvement is like this more in the first few months, but we know that people can continue to make slow gains over time. So I'm thinking to tell people to never give up, to continue to push to what they can do. The gains may be very slow now and maybe small, but we're learning so much more about the brain and its capacity for still learning and for building new cells that in terms of new pathways.
That's fun.
And
Good.
in terms of the pain, sometimes post-stroke people will have just maybe some of the sensory pathways were damaged, and they can experience pain, almost kind of the kind of pain, neuropathic pain that you hear about, limb pain that people might have when they've had an amputation, but they have that burning pain sometimes. I think it's important that that individual talked to the family physician. There are sometimes some medications that will help with that because that pain can be debilitating.
Thank you. Now, a little bit about you, since we are the fit addicts here, is if you can share with us your favorite types of exercise and what you do to stay fit.
Well, I am a cycling fanatic. I'm not a very good cyclist, and I did cycle for a long time, a lot, and then particularly I'm Canadian. When we moved to Texas, it was amazing to cycle year around. I don't cycle outdoors as much now, just because of the traffic and but I do cycle sort of in the subdivision. But I ride a bike in the house. So I love cycling. I think that's probably I used to run a bit. I don't run much now. I cycle more. I'm not a very good swimmer. I sort of enjoy that sometimes. And then I really like training and training with a trainer and doing weights.
Awesome. I love to hear all of that. It's my favorite. Now, Dr. White, can you tell us a little bit about either resources that individuals can reach for some support given for family caregivers in this particular situation?
Yeah, I would, so we have a program that's focused on family caregivers of people caring for someone who is living with a diagnosis of dementia. And
Mhm.
so I would recommend our program at UT Health. And our website is utcaregivers.org, where you can find the email to our program and see the events that we offer. At this point, all of our events are at no cost to family caregivers. And then depending on the chronic neurological condition, the American Heart Association has very good resources for families. And then there's also the Family Caregiver Alliance that you can just Google online, that has really excellent resources for family caregivers as well.
Excellent. Thank you so much. With that being said, Dr. White, I want to thank you for your time and for the valuable information you shared with us today.
Oh, love being part of this. Thank you so much. Have a good rest of your day.
Thank you. And thank everyone for joining the Fit Fanatics today.